This is Dr. Arun Thankaraj, specialist gastroenterologist, Aster Clinics Discovery Gardens. I would like to share a few tips on fasting during the Ramadan period. First, I will be discussing more about the digestive tract, then discussing about the tips during Ramadan, and finally we will conclude with special situations. Digestive system is like an orchestra. There are different organs from the mouth to the esophagus, the food pipe, the stomach, the liver, pancreas and intestines. Everything has to be in sync for a good digestive health. Our normal food habits range between 3 to 4 times per day, but during the period of Ramadan, this is little altered because of the fasting. Sometimes fasting can go up to 14 hours. So this can create some difficulties in patients' digestive system. So what are the foods we can eat during Ramadan period? Before that, let me discuss about what can be the ideal timing of the food you can take during Ramadan. So the first thing about the physiological fasting. Physiological fasting means we fast during our night time when we sleep, so we don't take food. So breakfast is very important. Same ways, even a patient during fasting can take 3 meals per day. That will be first during the suhoor period, which is a very important period. Patient should not miss the suhoor meals. Then it will be during the iftar time when they break the fast, and finally post maghrib time when they have their prayers. So the foods which we can take ideally during fasting, after the fasting are, during the iftar period you can break your fast with plenty of fluids. Water intake is very important. Dates, non-citrated fresh fruit juices you can take, laban, yogurt you can take during the fasting break. Then what are the foods we should avoid? See, anything which is very oily, very spicy, carbonated drinks, pastries, donuts, croissants, all have to be avoided. Highly salted food can increase your thirst, so all these salted nuts and other things should be avoided. So coming to the special situations. So some patients are already having gastritis, or they can have a gastric ulcer. They might be already on medications. There might be need for medication thrice a day also. So how do we go about this? The first thing is that even patients who have mild gastritis or gastroesophageal reflux disease, heartburns can do fasting. The only thing, we try to adjust their dosage from the morning until after iftar. So we normally miss the afternoon dosages. In special situations, suppose the patient is a diabetic, then it's better that he consults his diabetologist before making a fasting plan. Other situations where patients have renal diseases, kidney diseases, or they have heart diseases, or anything lung related issues, anything, they can always consult their appropriate specialist before making a plan for fasting. So these are the common things we should avoid and take during Ramadan period. Thank you very much for your patient listening, and wish you all a very happy Ramadan. Ramadan Kareem.